All right. Hello there, class. My name is Anthony Lung, and today I'll be teaching you about computer tomography and understand the basics of what CT imaging is all about. So, to start off, what is CT? So, CT is basically a diagnostic imaging tool that uses X-rays to create detailed cross-sectional images of the body. It also combines multiple X-ray images taken from different angles to generate 3D representations. So as you see over here on our right-hand side, there's a photo that I'm moving my cursor around. That is the first introduction of a CT scanner. And on the bottom of that photo is our more modern, what you're more used to seeing out in the medical field of a CT scanner. A brief history of how CT was even created is by these two gentlemen right here. Um, it was invented in 1972 by a Sir Godfrey Hounsfield and a Dr. Alan McCormack, or Dr. Alan Cormack. Apologies. First clinical CT scanner was installed in 1974, and since it revolutionized the medical imaging field entirely, they both earned a Nobel Prize in 1979. So, how does CT even work? Well, if you see on this photo right here, patient is lying down onto the table. Then it'll go into the big donut, aka the CT scanner. And once it receives its imaging, it'll go automatically into the computer in order for post-processing and visibility for our radiologists to see. So a more detailed, or I guess a more definition of how a CT works, X-ray tube rotates around the patient. Detectors capture the X-rays after the body passes through, and then a computer just processes all this data to create cross-sectional imaging. So CT versus other imaging modalities. As you see right here on this chart, you have CT, MR, X-ray, and ultrasound. Radiation for CT, yes. MRI, no. X-ray, yes. Lastly, for ultrasound, no radiation is given. The imaging type, as you see here, is cross-sectional for CT, just soft tissues for MRI, 2D imaging for X-ray, and then for ultrasound, it's just real time. And how it breaks it down for each modality and what they're best used for. As you see here, CT is best used for bones, lungs, or anything trauma related. MRI, more specifically towards the brain, muscles, and joints. X-ray, you have chest and bones. And lastly, for ultrasound, you have abdomen, or more so for pregnancy, just to see where that baby or what the baby is. Common uses for a CT, you have traumas, stroke and brain imaging, cancer detections, and from there, you could definitely see the type of stage of cancer that is presented, as well as cardiac imaging, and then also lastly is guiding biopsies and interventions. Some advantages of a CT are fast and non-invasive, and underneath that is multi-slice slash multi-detector CT, or so MDCT, as well as high resolution imaging. And with the high resolution imaging, there's improvements of spatial resolution, which allow better visualization of small anatomical structures, which is very crucial in areas like pulmonary imaging, cardiac scans, and lastly, neuroimaging. And you can definitely see bone, soft tissue, blood vessels all simultaneously within a CT scan slice or image. Risks and some considerations of using CT scans that you should all be aware of are exposures to radiation, obviously, possible reactions to contrast, and lastly, it's not recommended to use CT for pregnant patients unless necessary. Recent advances in CT. Well, you have low dose CT techniques, dual energy CT, AI assisted imaging reconstruction, and lastly, CT colonography and cardiac CT. A CT scanner technology has advanced so much over the years. that's resulting in faster, safer, and more accurate diagnostic imaging. Modern scans feature multi-slice and multi-detector capa capabilities, excuse me, um, some capturing up to maybe 640 slices per rotation, which would allow a rapid high-resolution scan. Innovations like photon counting detectors and dual energy or spectral CT have definitely improved soft tissue differentiation and image clarity, which reduces radiation exposure. In summary, CT is a very powerful and versatile imaging modality. It provides quick and detailed information crucial for diagnostic and treatment planning. And lastly, ongoing advancements always continue to improve our quality image while reducing the risks of radiation exposure for patients and even medical professionals. Now, any questions to be held? No questions at all? Well, thank you so much for me introducing or sharing you the basics of CT scans. Thank you. Enjoy your day.